If you have PCOS, there could be a silent metabolic argument happening in your body right now, specifically in your liver, that most health professionals are missing. It's a condition that signals future heart disease risk more clearly than a PCOS diagnosis alone, especially when you know your specific PCOS type. But the good news, new research shows that one specific conversation, beginning with a literal script I'm going to give you at the end of this video, can interrupt this process before it becomes permanent. So let's decode what that argument is about. A 2025 study revealed that 31% of young women with PCOS already have liver fat accumulation. Even more critically, among those with liver fat, 65% met the criteria for metabolic dysfunction-associated fatty liver disease, or MAFLD. This matters because MAFLD isn't just fat sitting there. It signals that your liver is actively inflaming your blood vessels and altering your cholesterol profile in ways that directly increase your risk of heart disease. Think of it this way. Your liver is the control center for managing your blood fats and inflammation. When it's struggling, it can't do its job. Bad cholesterol builds up in your arteries, and inflammation damages the heart's pipes. That can lead to heart attacks or strokes, which is why catching this early really does matter. And I know that sounds scary, but here is the critical part. Not everyone with PCOS has the same risk. The research discovered a surprising metabolic pattern. Some people with PCOS have lower MAFLD risk even if carrying extra weight. We'll talk about exactly what determines your risk in a moment and how to know if you're in the higher risk group. But first, we must correct a gap happening in many clinics. If your health professional is only looking at your ultrasound for cysts to determine your metabolic risk, they're missing the map entirely. The researchers found that the true drivers of liver fat were two specific PCOS features. First, hyperandrogenism, which means high testosterone. It might show up on blood work or through symptoms like acne, unwanted hair growth, or scalp hair loss. Second, oligomenorrhea, which means irregular or absent periods. When you have both of these together, your MAFLD risk jumps significantly. When you have cysts without high androgens, your risk is lower. This is the vicious cycle the study describes. High androgens drive insulin resistance. Insulin resistance tells your body to store fat in the liver. Liver fat then worsens the androgens. It's a loop. If you have those two symptoms, high androgens and irregular periods, you are in the specific group that needs targeted screening, not just generic PCOS monitoring. Now remember that metabolic pattern I mentioned? Here's the hopeful part. While MAFLD is common in young women, many haven't developed advanced stages like fibrosis or scarring. This means if you are young and have these symptoms, you are in a critical window. Your liver could be flashing a warning light, but the damage may still be reversible through early intervention. So how do you use this knowledge? I want you to consider using the liver check script at your next appointment. Don't just ask for a generic liver test. Instead, say this: I've read recent research showing that people with my PCOS phenotype, high androgens and irregular periods, have a significantly elevated risk for metabolic dysfunction-associated fatty liver disease. Since research shows cysts alone don't predict this risk, would you be willing to run a focused liver screening, perhaps including ultrasound and liver function tests, to establish a baseline? This moves the conversation from generic weight loss advice to precise PCOS type-based metabolic care tailored to your specific risk factors. And speaking of precise, PCOS-specific care. If you feel like you are constantly guessing with your health, I want to give you the map. I've created a complete 19-part foundational roadmap called PCOS Body Beautiful. It's completely free, and it's the step-by-step operating manual you should have been handed the day you were diagnosed. It walks you through every system, from your insulin to your hormones to your gut and beyond. So you stop guessing and start healing. It is the blueprint for your body's peace, and you can start watching right now at the link in the description. Now take a breath, let that plan settle, and I'll see you Sunday for your weekly PCOS research decoded.